Hello everyone, welcome to English class. How are you class? Well, today we will learn specific tasks that you can find in working environment as medical workers, whether as pharmacists or nurses. The tasks are labels and prescription. For those who are learning in medical field, it's really important to know about these kinds of tasks. Well, let's discuss about labels first. I'm sure that most of you have been seen labels in many products before because it contains information about the product. Mostly you can find it at the back of the product wrapping. Jadi paling sering kita temukan pada bagian belakang pembungkus suatu produk, di mana berisi segala informasi tentang produk tersebut. The social functions of the labels are, first, to choose food, beverage, medicine, which is suitable and safe. Jadi fungsi label yang pertama adalah agar konsumen dapat memilih makanan, minuman, obat yang aman dan sesuai. Second function is to avoid negative effects of food, beverage, medicine, yaitu mencegah efek negatif suatu produk. And third, to get the best result of medication, yaitu untuk mendapatkan hasil terbaik dari suatu pengobatan. Jadi dapat disimpulkan bahwa fungsi suatu label adalah memberikan informasi tentang suatu produk secara jelas. And next, we'll discuss the language features of the labels. First, using specific terms for product like serving size, serving per container, doses, and values. Second, using imperative sentence. Di sini imperative sentence dapat berupa kalimat perintah atau larangan. For example, like keep the syrup in a dry place. Keep away from children. Don't accept the product if the seal is broken, and etc. Third is using noun phrases. Examples like significant source, dietary fiber, saturated fat, and etc. Next, let's discuss about the generic structure of label. It includes name of the product, name of the brand, description of the product, the ingredients or the contents, the nutrition facts, suggested uses or doses, storage, and expired date. In some products, especially medicine, there are some additional parts added, such as indication atau indikasi, side effect atau efek samping, warning atau peringatan, and precaution atau tindak pencegahan. Now, let's check this example. Please read the label first by pausing the video. Now, let's analyze the label. By reading the label, we know some information about the product. Like first, the brand of the product is Pinox. Second, the name of the product is children cough syrup. And then number 3, the description of the product is cough mixture of formula 440. Next, the content or amount of the product is 75 ml. And the usage of the product is to relieve dry cough. And number 6, the directions to use and the doses. Use medicines according to physician's instruction. And number 7 is the direction to store. First, keep it in moderate temperature. And second, keep away from children. And the last one is the expired date is on the 20th of June 2021. Well, now let's move to prescription. A prescription is an instruction written by a medical practitioner that authorizes a patient to be provided a medicine or treatment. Jadi, prescription adalah resep dokter. Prescription aims to give information about medicine or treatment given for a patient. bertujuan untuk memberikan informasi tentang obat yang akan diberikan pada pasien. The language used in the prescription must be clear, and mostly they use specific terms in the medical field. Jadi bahasa yang digunakan haruslah jelas, dan kebanyakan juga menggunakan kosakata khusus yang digunakan di bidang kesehatan. Next is the parts of prescription. Please read the example of the prescription and pay attention to the number written on the parts of the prescription. Silahkan dibaca contoh resep dokter berikut dan perhatikan masing-masing part yang telah diberi nomor. Let's see number 1. Number 1 is patient's information. Here it consists of name and age of the patients. Di contoh di sana diberikan nama dan umur pasien. Number 2, prescription date atau tanggal resepnya. Number 3, Rx symbol. Rx symbol is usually said to stand for the Latin word prescribe, meaning to take. It is part of the superscription or heading of a prescription. Number 4, medication prescribed. It contains drug name, drug strength, and drug formulation. Jadi berisi nama, kekuatan, dan formula obat. Number 5, dispensing direction. It contains the amount of medicine that the pharmacist will dispense, including the bottle size, ointment tube size, or number of tablets or capsules. Jadi berisikan berapa jumlah obat yang harus diberikan oleh apoteker kepada pasien. Number 6, patient's use direction. It contains details for how and when the patient will use the prescribed medication. Di sini berisikan secara detail bagaimana dan kapan pasien menggunakan obat tersebut. Number 7, refill. It contains whether the medicine will be refilled later or not. Berisikan apakah obat tersebut di-refill atau diberikan lagi nanti atau tidak. Jika tidak, cukup ditulis none. Number 8 is prescriber's information. Berisikan identitas dan tanda tangan dokter yang memberikan resep. Well class, that's all information about labels and prescription. Thank you for watching.